The DCI Series 4 chair. The Series 4 chair has the same jack system that we put on the Series 5 chair. On the foot pedal, you've got the same foot switch that we use. Again, you've got the up motion, the down motion as far as the chair base, the back with the chair back, reclining, and then to bring the patient forward. With the Series 4 chair, we use more of a rounded look, which matches our Series 4 product line. The chair arms on the Series 4 chair also work the same way. They will twist out and back around and back in. The headrest is the same double articulating headrest that we use. It has a straight back on it versus the V shape that's on the Series 5. The Series 4 chair, as far as programming, you still will have a number 0 and a number 1 that is a preset position. To set either of those, if I push the number 1 for an operating position, and then let's say I want to change that to where I want it to be a little bit lower and the back down further as a patient operating position, I'm just going to hold in on the number 1 button. The chair will beep at me, and that's where that chair will go each time I hit number 1. The 0 button programs the exact same way we programmed the number 1. So wherever the chair goes, let's say I want to bring this chair base down a little further, or the back further back, or up further. Once I get it to the position I want, I'm then going to hold down on the 0 button until the chair beeps at me. And that's where that chair in the 0 position will go each time I hit 0. Also on the foot control, there's a return arrow at the top of the foot switch. I'm going to go to position 1. And let's say I've been sitting here for 30 minutes working on a patient, and maybe I need to get up and make some lab calls or work on a denture where I'm going to be out of the treatment room for 20-25 minutes. So let's make your patient comfortable by bringing the chair back up, letting them rest a little more comfortable while you're gone. And as soon as you come back into the treatment room, if you hit the return arrow button, it will take the chair back to that pre-adjusted position that you had before when working on that patient. It just saves a little more time in trimming the chair. A couple other features of the Series 4 chair. It is on a swivel. There is a brake mechanism that's on the back of the chair, which you can unlock, and you can swing the chair 30 degrees both directions and then relock it in the position that you want to. And then the other thing I think we covered earlier is just both chair arms will completely swing out to allow easy access in for the patient. Also, when the chairs completely swing out, there still is something here for the patient to grab onto when they exit or enter the chair. Maintenance on the Series 4 chair, your upholstery, barriers are still going to be the most effective way to protect your upholstery from deterioration over time. If you're using disinfectants, the disinfectant basically will extract the oil out of the pores of the upholstery material and eventually cause your drying and your cracking. We sort of suggest to use Murphy's oil soap once a week. If you use the Murphy's oil soap in a general cleaning dilution, you can wipe the chair down, get rid of all the oversprays, but also you will impregnate the pores of the upholstery with a little oil, offsetting that drying effect. Okay, one option that you can have on the Series 4 chair is the electric outlet with the air-water quick disconnect. This device will actually be mounted up underneath the left side of the chair or the assistance side of the chair, which will have two 110 electric outlets. So if you want to plug a Cavatron or something in it from around the chair, The yellow ring is an air quick disconnect, the blue ring is a water quick disconnect, and then the water flow adjustment valve will control the water flow that comes out of the water quick disconnect. But again, it does give you access to be able to plug a Profi-Jet in, Cavitron in, and then be able to move these peripheral devices from room to room. One of the things that could happen, you're in a new office with a new chair, is you come in the morning and the chair just doesn't function. It won't go back, it won't go up, it won't go down. Basically, it's almost like the electric's been discontinued. What I have found out to be 95% of the cases is on the front lower section of the chair, there is an on and off switch. This switch here just makes sure the green light is on. So turn the switch. Once the green light comes on, the chair has electric to it, and then it should function. But that probably is 95% of the calls I get when a chair doesn't work in the morning.